So when I became a sexual assault nurse examiner a few years ago, I started to see this phenomenon that nobody was talking about. And what I was seeing, since I only work with children, is that our perpetrators, so not just the kids being assaulted, but the perpetrators are extremely young. And our biggest age range of perpetrators are 11 to 15-year-olds. We see one of the highest volumes of patients in the nation. We're in the top 5% of seeing the highest number of victims, whether that's children or adults. We're seeing kids where the only risk factor is exposure to porn, and that is creating them to act out in ways that are really harmful and really dangerous. And so I think it's a scary phenomenon that's happening, and yet we don't really hear about it in society. You see the way pornography is so influenced, from incest to multiple perpetrators, to them creating amateur porn, to degrading her, to exploiting her. And I feel like that's a trend we've seen where it's almost this normalized thing to watch other people have sex. I mean, it's the stereotype that you think that it's a boy perpetrating on a girl. However, there are a lot of very young male sexual assault victims as well. So I think it's overwhelming because it just feels like, man, how do we stop this? And that's just so much trauma and pain created in those moments. I've never heard a teenage girl come in, like someone who has the cognitive ability to kind of process what's happened and say, I know that was rape, it wasn't my fault. Sexual assault innately makes people feel like, this was my fault, I deserved this, I must be bad, that's why this happened to me. And so frequently my job is just saying, this is not your fault, I'm so sorry, over and over, because we want to validate and empower kids who have been hurt.